Welcome back to Today's Health. In this segment, we're speaking with board-certified radiation oncologist, Dr. Matthew Johnson. Dr. Johnson, thank you for joining us today.
Thanks, Michelle. I'm happy to be here.
Now, can you tell us, the Karmanos Cancer Institute here in Port Huron, how is that a benefit to our community?
You know, I think the biggest way it benefits the community is it gives us access to a state-of-the-art cancer facility that's local, and it allows our patients to avoid having to travel. We have the most up-to-date technology for delivering radiation treatments. And also, as part of the Karmanos network, this allows our patients to participate in clinical trials, and it also gives them access to a broader range of specialists.
And to have all of those services available, not have to travel, is really a good benefit for our community.
Absolutely.
Now, since we're talking about lung cancer today, what types of radiation oncology treatments are available at Karmanos in Port Huron?
So the two most common kinds of radiation used in the treatment of lung cancer are the stereotactic radiosurgery and external beam radiation therapy.
Okay, let's start with the external beam radiation. Can you tell us more about what that is?
Sure. So the external beam radiation therapy is generally used for patients who have more advanced lung cancer. And what the external beam radiation is it's a non-invasive treatment where we give a small dose of radiation each day, Monday through Friday, 5 days a week. And generally this is given over the course of several weeks. And for some patients it can be done at the same time as the chemotherapy. And really, the treatment sessions are quite short. Most patients are in and out of our department in about a half hour. But we use advanced planning techniques so that we're able to deliver a high dose of radiation to the cancer and as safely as possible decrease the patient's potential side effects from the treatment.
So after such a short amount of time, a half hour to receive this treatment, can the patient go back to work or carry on with normal functions?
Certainly, and many of our patients do work while getting this treatment. And obviously, as it's not an invasive procedure, we don't require anesthesia or any pre-medication. And the radiation is something that there are side effects, but generally it takes time. They're more cumulative. For the most part, patients are feel the same after they walk out of the department as when they walked in. And these treatments are delivered with image guidance each day as well.
Can you tell us more about that? What is image-guided radiation?
Sure. So image guidance is basically when we have a patient come in for each one of their radiation treatments, right before we give them the radiation treatment, we have a low-dose scan performed of their body so that we can see their normal structures, we can see their tumor, and we can make sure that everything's lined up perfectly and that tumor is right in our target. This allows us, even if we're just a few millimeters off, to see that and correct it before actually giving the patients the radiation.
Now, you mentioned earlier the stereotactic radiosurgery. Can you tell us more about that?
Absolutely. So the stereotactic radiosurgery is generally used for patients with early stage cancer. And it's typically used when patients, it's a non-invasive treatment option for patients who either can't tolerate a surgery or some patients refuse to undergo a surgery for an early stage cancer. And the treatment itself consists of a short number of treatments, usually 5 or fewer, where we deliver very high doses of radiation in that short amount of time. And while those treatments do take a little bit longer each day than the external beam radiation treatments, most of our patients will finish their treatment in under a week, and most patients will have little or no side effects from this treatment.
Wow, that's awesome. Dr. Johnson, this has been great information. Do you have any closing comments for our viewers?
In general, I think, I wanted to make sure the viewers were aware that lung cancer, is a very big problem, and it's something that in recent years there has been some research showing that there is a benefit to doing lung cancer screening. And what this is something that if you talk to your primary or your family physician about it, patients who are older than 55, if you've smoked approximately a pack a day for 30 years, even if you've quit within the last 15 years, you qualify to get a low-dose CAT scan. This is a much lower dose of radiation than has previously been done for CAT scans, and it allows our patients to get this kind of a screen to see if there's anything suspicious. They'll have 2 more CAT scans over the next 2 years, and it's actually been shown, this study that was published was shown to improve survival. It helps detect lung cancers when they're earlier stage. And I can certainly say as a radiation oncologist that the earlier these cancers are caught, the better we ultimately do. So, I encourage patients to, speak to their primary physician if they think that they might qualify for this, or, certainly if they're having any symptoms that they might find worrisome for lung cancer, to also, seek medical care for it, not to kind of avoid the issue, because the sooner we start the treatment, generally, the better.
Yeah, screening is so important so that you can manage that before it gets worse. Doctor, thank you for joining us today.
Of course.
And thank you for watching. You can watch Today's Health, request a copy of our program, and access other reliable healthcare information by visiting our website. As always, tune in next time to Today's Health. Today's Health is brought to you by McLaren Port Huron.